Good afternoon, everyone, and welcome to another episode of Sunday Housecall. We hope that you had a wonderful week, and we're here again bringing you one of the best medical information and education for you. As usual, a lot of these topics that we talk about, it's not necessarily for you because we don't know you as an individual, but it's for the public, and you always have to talk to your doctor to make sure that these advices are appropriate for yourself. We're very honored to have a very special guest today. Dr. McCance is with us, and this is based on the request of a lot of people out there who wanted to hear about back pain. And questions about lower back pain and neck pain is what we're going to be talking about. The treatment options, some of the medical treatment and surgical options that are available, and we couldn't think of anybody else who's more qualified in this field. This is the man who has operated on over 5,000 spine surgery. It's a successful outcome. I personally know him and his work ethics for over a decade. We've rounded early in the morning at 5 a.m. and we've left the hospital at almost midnight. So I know he's a very hardworking, great surgeon, and it's someone that I would send my own family members to him, and that's why I wanted him on this show. Sean, welcome to the program, and we hope that we learn a lot from you.
Thanks so much.
So, we're talking about obviously back pain. And as you know, millions of Americans are suffering from this. Yeah. This is one of the leading causes of disability in this country, and so many people actually go to doctors as a result of this. It's the leading cause of disability, and almost 8 out of 10 Americans are suffering from back pain. Why so much? Tell us about some of the reasons and risk factors and everything we need to know about back pain.
Sure. Well, it's a great question, and it is, a huge general population issue. Back pain can arise for multiple reasons. We have a very sedentary lifestyle at this point. Everyone's working in offices, everyone's on their iPad, people are losing core strength, posture's affected. As you get older, your muscles weaken. And if you're not active, if you don't maintain a good core, if you don't maintain good muscle strength and posture, you can predispose to back pain. That's certainly one major issue in the public.
I think probably the way we're structured, and you have actually the whole image and the prop for about the spine. Maybe you can show us the way. Understand this building. Maybe you can show us the actual spine. The way this was really set up is for us to be standing, and because of all this technology and the iPads and the fact that we're sitting behind computers for years, the pressure on these discs and the inflammation that they cause, is that part of it? Maybe you can demonstrate exactly what we're talking about here.
Well, the way the spine is designed to work, you have something called lordosis and kyphosis, which are the normal curve of the spine to keep us upright. And with slouching and leaning forward, that puts enormous tension on the muscles on the back. So all these muscles are now fighting to pull you back. And if you have bad posture and you end up like this, you put enormous strain on this whole area. This happens when you're sitting hunched over a computer all day or exhibiting poor posture. Your muscles have to work harder, the joints in the back become inflamed, and also when you flex forward, you're putting more load on the discs and they can become inflamed.
By the way, I have that same problem as you just discussed, because as you know, as a robotic surgeon, I sit behind the robot and you're constantly leaning over, and I can tell you that by 5, 6 o'clock, I have tremendous pain in the lower back, so I can totally relate to this.
Right.
And what do you do to avoid it? Is it certain, I know the posture has to be in a good position, but is there certain chairs or certain things I can do in order to be more comfortable?
Well, ideally, we're designed to be like this. That allows the normal mechanics of the spine to function between the posterior and the front, the back and the front of the spine, so you sit in a neutral alignment. So having the proper height, getting up every half an hour and walking around, changing your position, adjusting your desk height, adjusting your computer height, all these things can allow you to get into that better posture and avoid the wear and tear that you're talking about as the day goes on.
Now, when you look at the spine like this, even though we don't see a lot of the structures, Sean, there's a lot of ligaments and muscles and nerves and bones involved in this.
Exactly.
So what happens? Is it muscular pain? I mean, as a urologist, I see a lot of people coming in saying, I may have a kidney stone, I have this back pain, and it's always like kidney stone that comes to their mind. But is it mostly ligament issue? Is it like the disc? Is it muscle?
It's a combination. If you go out on the weekend, let's say, and do a little extra exercise and you flex forward and lift something the wrong way, you could strain all the ligaments that are between these bones. And that little ligament tear can be extremely painful. That pain typically lasts a few days to a week or two. It gets better with Motrin or Advil. Or the chronic tension of the bad posture is muscle. But then a huge driver of back pain is the disc. Somewhat as you get older, after age 30, 40, the disc starts to degenerate. The discs, as you can see here, they're like shock absorbers.
Where
like
are
tires
these
on a
discs
car,
located?
in the front of the spine.
Okay.
They're the major weight-bearing part of the spine. I often tell patients they're like tires on a car
Okay.
or a shock absorber. And if you get a flat tire, the air goes out of the tire, it becomes weak, and it can't take load. As the disc becomes weak, it becomes inflamed, and that in and of itself becomes a huge source of pain.
So somebody asked me online, you know, I take calcium and I take my vitamin Ds. Is that going to help me with delaying some of this disc generation that's calcium or any of
So
this?
calcium and vitamin D is very important for bone health and avoiding osteoporosis. It does nothing to do with disc degeneration or muscle tension or muscle inflammation.
So how do you slow that process down?